Cannabis has become a hot topic, especially in the last couple of years because of its increasing legalization nationally, although it isn't legal everywhere. In the United States, many states have both recreational and medicinal laws. In the state of Michigan, it recently in the last year became legally recreationally, which has made it easier if patients want to use it to be able to have access to cannabis. I think it's helpful for your members if I take a 10,000-foot view on cannabis before I dive right into whether it's helpful or not, and really talk about cannabis in general. So cannabis is what most people refer to as marijuana. Typically is primarily derived from cannabis sativa, although there is a second plant, cannabis indica. Cannabis is composed of hundreds of phytocannabinoids. Phytocannabinoids are plant-based cannabinoids. These act at the endocannabinoid system, which is located in the body and in the gut. So given that I've given you this basic overview, I think the most important thing I can stress to patients when it comes to cannabis is that they need to talk to their provider about using cannabis. In my clinic, we ask about many complementary therapies, including probiotics, dietary supplements, meditation, mindfulness, but we also ask about cannabis use and other potential drug use too. So now we can jump into what does the data show? And I'm going to lump this again for ulcerative colitis and Crohn's disease. Although they have been studied separately, the data from a 10,000-foot view looks very similar. So they've looked at various formulations. This is both CBD only, CBD with THC at various percentages, as well as THC alone. And what they found is that there's been no significant impact on patients' inflammation when they use cannabis or a cannabis derivative, so CBD or THC. So cannabis, it's studied in its current form, does not appear to impact inflammation. So that's an important take-home point. However, these studies have shown that patients, both with ulcerative colitis and Crohn's disease, but we've seen more benefit in patients with Crohn's disease, have improvement in their symptoms. And remember back when we spoke earlier, is that not all symptoms are inflammation. People can have symptoms, but it's not necessarily the inflammation. So it has been benefit in terms of improvement in abdominal pain, nausea, increase in appetite, weight gain, as well as reported improved quality of life when patients incorporate cannabis or cannabis derivatives with their medical therapy. So none of these studies have looked at cannabis as a substitute for medicines. All of these studies have looked at cannabis as an addition to already stable FDA-approved medical therapy for treatment of both ulcerative colitis and Crohn's disease. So the bottom line is it can be useful in some of our patients as an adjuvant therapy, which means they use it in addition to their medical therapy, working with a healthcare provider to help control ongoing symptoms. We have no data to support that it replaces traditional medical therapy. And I think that what the thing that's lacking in our current state is this open conversation between a treating provider and a patient. We know that many patients don't disclose cannabis use to their providers, and we know that many providers don't ask about cannabis use with their patients. So I'd like to help change that conversation and make sure that we're having an open dialogue about it and understand why patients are using it. If I have a patient with ulcerative colitis that has no symptoms, feeling well, but is using cannabis, I often ask them why they're using cannabis. And then they'll say, well, it actually improves my appetite. Okay. But if they're telling me that they're using cannabis to control their diarrhea, and the reason why they're feeling well is because they actually are having diarrhea and the cannabis is improving their diarrhea, which it has been known to do as it can slow down the motility of the colon. We need to first ask that most important question, which is, do they have underlying inflammation? The cannabis may not be treating that inflammation. It may be improving the symptom, but they may have active disease that we really need to be addressing with their medical therapy. So I think it opens up a conversation that really allows a provider and a patient to partner together. In addition, it's important to note that cannabis is not risk-free. So while there's been studies in the general population looking at various outcomes associated with cannabis use, including interactions with different medical therapies, in particular blood thinning therapies, which can be important to save people's lives, in addition to an increase in motor vehicle accidents with cannabis use. There have been some studies looking at poor outcomes in patients, particularly with Crohn's disease. In a large study done in Canada, patients with Crohn's disease that used cannabis compared to those patients with Crohn's disease that did not use cannabis were significantly more likely to require surgery for their disease. While there might be other explanations for this, it's an important flag for me, at least, to say what's going on here, and maybe we should be a little bit more cautious in using cannabis because it's not risk-free, just like many of the medical therapies that we use. It's really dependent on the patient and the symptoms that they're trying to treat. And again, we're very limited in our knowledge and understanding of what we should even tell patients. It's very obviously state dependent. I imagine that your audience is throughout the country. And so it depends on what their state is. Some states are medicinal legalization is a high CBD to THC ratio. So the formulation is mainly driven by a CBD component compared to the THC component. And so it's not really an option to tell them what to do. But again, based on the studies that we have, we don't really have guidance in this, and so that we need more information. And I'm partnering with a colleague to start looking at some of the data coming out of New York, so that we can try to better educate our patients. So it's not a shot in the dark. Patients will ask me, should I take it once a day, twice a day, 3 times a day? Should I smoke it? Should I use an edible form? And I do prefer that patients use an edible form. However, the expense of the edible forms is greater than that of the inhalation forms, because of the effects of inhalation and potentially long-term risks of inhalation. We know that edible forms are slower onset, but they last longer. So for somebody that has symptoms throughout the day, that might be a better option versus somebody that has acute pain that they're trying to manage with cannabis. They would want something that's faster acting. And so that may be in the form of an inhalation form or in a sublingual form, which means that they can put it under their tongue, or they have some sort of, easier absorption than, oral, which requires, metabolism through the GI tract. But there's so many nuances to this. So it's hard to give that advice. And it really requires a patient working with their provider. And many of these providers don't have knowledge of this. I'm well versed in it, and I don't even know what to tell patients sometimes. And we use a trial and error approach. I ask them what formulation they're using, and if it's working for them, then we work with that. But if it's not working for them, then we try to maybe manipulate it and try either higher levels of THC, lower levels of THC if they're having side effects related to THC. We know in some of the studies that the most common reason for discontinuation was with higher levels of THC because of side effects. And yeah, and I think that if there's any takeaway from the time we've spent together is your provider is there to partner with you. And if you don't feel that your provider is on your side or is your partner, that's an opportunity to seek a second opinion, to find a provider that is there to partner with you. Our goals are the same. Our goals are to make you feel better, make sure that we get your disease into a quiet state to prevent you from feeling poorly in the future, and using all the tools that we can to do that. It's not always just FDA approved medical therapies like we talked about. We have a lot of tools in our toolbox to do that, and a lot of data to support use of various approaches. And so the only way that you can know that is to chat with your medical provider about your concerns about, ongoing abdominal pain despite the fact that the Crohn's looks in remission, and how can we address that? And certainly, cannabis is one way, hypnotherapy is another. Improving sleep quality could actually improve abdominal pain. Adding mindfulness and yoga and meditation is another way that we can do that. Different dietary modifications. We partner very commonly with our dietitians, and just changing a few things in your diet, especially those fermentable sugars, can actually result in reduction in abdominal pain, if not resolution. And so it's not just one avenue. I think opening that discussion or having that discussion opens up so many opportunities for discussing alternative treatments and how you can incorporate those into your current medical regimen to improve your quality of life.